Thank you for watching today's video, in which we discuss signs of prostate cancer in older men. What you need to know. Prostate cancer is one of the most frequent cancers to occur in men, particularly those above 50 years of age. Early detection is quite crucial for proper treatment, yet most men may not observe the signs or prefer not to notice them. In this video, we'll explore the common signs and symptoms of prostate cancer, the risk factors, and the importance of early screening and diagnosis. Section 1. What is prostate cancer? Prostate cancer is when the cells in the prostate gland grow abnormally and form tumors. Prostate is a small gland in the male reproductive system that makes the fluid that nourishes and transports sperm. Although prostate cancer tends to grow slowly and might not cause symptoms at first, it can spread to other parts of the body if not found and treated early. Prostate cancer is the second most common cancer in men. The majority of the cases are in older men, but younger men can develop it too if they have had the disease in their families. Section 2. Risk factors for prostate cancer. There are a number of risk factors that can predispose one to getting prostate cancer. Some of these are non-modifiable, while others can be controlled to prevent the risk. 1. Age is the greatest risk factor for prostate cancer. As men get older, their risk of prostate cancer increases, especially after age 50. Prostate cancer is uncommon in men under age 40, but the risk rises sharply after age 50 and continues to increase with age. 2. Family background. A family history of prostate cancer can put a man at greater risk for developing the disease. If your father or brother had prostate cancer, you might be at increased risk. 3. Race ethnicity. African American men have a higher chance of having prostate cancer, and it is usually more aggressive in them. Asian American and Hispanic men typically have a lower risk than them. 4. Genus-inherited genetic mutations from parents, like BRCA1 and BRCA2 gene mutations, can raise the risk of prostate cancer. The genetic mutations also put individuals at risk of breast cancer and ovarian cancer, with men who have the mutations having a higher risk of prostate cancer. 5. Lifestyle and diet. Eating large amounts of red meat and processed food and not exercising can put a man at greater risk for getting prostate cancer. A diet that includes many fruits, vegetables, and whole grains can lower the risk. Section 3. Signs and symptoms of prostate cancer. Prostate cancer typically develops slowly. At first, it may not have definite symptoms. However, as the cancer increases in size, it may interfere with urination, sexual function, and overall health. These are some of the usual signs and symptoms of prostate cancer. 1. Increased urination. One of the first symptoms of prostate cancer is the need to urinate more often, especially at night. Nocturia. This occurs because the prostate cancer may push against the urethra, which drains the bladder. 2. Trouble starting or stopping urination. Prostate cancer in men can lead to difficulty starting or stopping the urine flow, similar to symptoms of benign prostatic hyperplasia (BPH). This is because the tumor may obstruct the flow of urine through the urethra. 3. Weak or stopped urine flow. Weakening or interruption of urine flow is one common symptom, since the cancerous prostate obstructs the free flow of urine. Men will find it takes longer to empty their bladder. 4. Blood in urine or semen. Blood in the urine or semen is a harmful symptom of prostate cancer. It may also happen because of other disorders, but it should not be disregarded and necessitates a visit to a health professional for evaluation. An older adult is aware that there is blood in his urine or semen and is upset. 5. Pain or discomfort in the lower back or pelvic area. When prostate cancer grows, it may spread to the surrounding tissues and bones. It can lead to pelvic pain, lower back pain, pain in the hips or thighs. Ongoing pain in these areas needs to be assessed by a doctor. 6. Painful ejaculation. Pain or painful ejaculation could be one of the symptoms of prostate cancer. This occurs when cancer is present in the prostate or in tissue surrounding the prostate and causes pain during sexual intercourse. 7. Fatigue or unexplained weight loss. Prostate cancer that is advanced can result in weight loss, fatigue, and an overall feeling of illness. These symptoms can be a sign that the cancer has already metastasized to other areas of the body. 8. Erectile dysfunction. Prostate cancer can impact sexual function and cause erectile dysfunction. If this symptom is new or keeps happening, it's a good idea to talk with the healthcare provider for an evaluation. Section 4. The importance of early detection and screening. It is extremely important to detect prostate cancer at an early stage for successful treatment and better results. Though prostate cancer tends to grow slowly, detecting it at the early stage can significantly increase the chance of successful treatment. 1. Prostate-specific antigen PSA test. The PSA test detects the level of prostate-specific antigen in the blood. Elevated levels of PSA may suggest the presence of prostate cancer, but other conditions, including BPH or prostatitis, may also result in elevated PSA levels. The PSA test is widely utilized for the screening of prostate cancer. 2. Digital rectal exam (DRE). When a physician does a DRE, he or she feels the prostate by placing a gloved finger into the rectum. This enables the physician to feel for any irregularities in the prostate, like lumps or swelling, that may suggest cancer. 3. Biopsy. If a DRE or PSA test indicates that prostate cancer might exist, a biopsy might be done to diagnose it. In a biopsy, the doctor takes tiny samples of prostate tissue and looks at them under a microscope. Section 5. Treatment options for prostate cancer. Prostate cancer treatment depends on how far the disease has spread, the patient's general health, and other factors. The treatment options are: 1. Active surveillance. If the cancer is growing slowly and not causing serious symptoms, doctors may suggest active surveillance. This means checking the cancer from time to time with PSA tests and DRE exams, and treating it only if it's needed. 2. Surgery. Surgery is typically used to eliminate the prostate gland when prostate cancer is confined to one area. This operation is called radical prostatectomy and can be accomplished using traditional surgery or less invasive methods, including robotic-assisted surgery. 3. Radiation therapy. Radiation therapy is the utilization of high-energy rays to kill cancer cells or shrink tumors. Radiation may be used alone to treat prostate cancer or in combination with other therapies. 4. Hormone therapy. Hormone therapy does this by reducing testosterone, a hormone that prostate cancer cells rely on to grow. This can make tumors shrink and slow the disease. 5. Chemotherapy. Chemotherapy is typically reserved for prostate cancer that has spread to other areas of the body. It employs medication to destroy cancer cells throughout the body. 6. Cryotherapy. Cryotherapy is a treatment that freezes cancer tissue to kill it. It is sometimes used for prostate cancer that is in one area or for patients who cannot have surgery. Section 6. Prevention of prostate cancer and prostate health. Certain risk factors for prostate cancer, including age and family history, cannot be changed. However, changes in lifestyle might be able to lessen the risk. 1. Maintain a healthy diet. Eating a lot of vegetables, fruits, whole grains, and lean protein foods can help lower prostate cancer risk. Tomatoes that have lycopene, broccoli, and green tea are especially healthy for the prostate too. Regular exercise. Irregular exercise can lower the risk of prostate cancer. Try to get at least 150 minutes of moderate exercise each week, like cycling, swimming, or walking. 3. Maintain a healthy weight. Having a healthy weight by eating the right foods and getting exercise can help lower the risk of having prostate cancer and other illnesses. Conclusion. In summary, prostate cancer is a treatable and serious disease, particularly when discovered early. Knowing the signs and symptoms, risk factors, and undergoing regular screenings can help manage prostate health. A healthy lifestyle, consistent checkups, and prompt treatment allow older men to enhance protection against prostate cancer and enjoy improved overall health. Thank you for viewing today's video. If this information is useful, kindly like, subscribe, and share with others. Let us keep maintaining our health as we grow older. Take care and see you in our upcoming healthcare videos.